mama toto? Twaweza?
Chama cha mama toto.
Chamas for Change has been implemented with the support of multiple donors over the past 12 years. In Trans Nzoia County, implementation began in 2017. The Chamas platform has enabled the implementation of the Chamas for Change, an IDRC Women Rise project. This study primarily aimed to evaluate whether participation in Chamas fosters resilience among women, safeguarding them against the impacts of pandemics and health emergencies. Additionally, IDRC's support enabled scaling the program within Trans Nzoia County, running alongside the study evaluation.
The Chamas for Change program was born out of poor maternal, newborn and child health indicators, and having specialists in the maternal, newborn and child health field who are obstetricians, gynecologists and pediatricians, we thought of what can we do to actually change, to make sure we improve maternal, newborn and child health indicators. And one of the things that is common in African setup is something called Chamas, where people come together to save and loan among themselves. So we took advantage of those existing infrastructure to say, what can we do to those particular Chamas to enrich it, to make sure we take advantage of it to improve maternal, newborn and child health indicators. So we come up with a hybrid model that is made of health education, that women discuss about how their health, social education, that they discuss different things that affect them in the community, and also have a microfinance component that brings them together. Because when we talk about health, we talk about we should go to the facility to seek healthcare services. But we all know if you don't have money for transport, it becomes very difficult. So the microfinance component supported that as arm, where they support themselves.
I underwent the training of Chamas for Change, and through that I began the journey of working with these expecting mothers all through their pregnancy period, delivery, and up to now we are still working with the mothers. So we are encouraging them to take their IFAS well. We are encouraging them to take proper diet for a pregnant mother. We are encouraging them to have a birth plan. So we are trying to ensure that these mothers have successful deliveries, and not only delivery, but a skilled delivery.
Initially, we could barely see women coming for all the recommended ANC visits. WHO recommended for 8 ANC visits and 8 ANC contacts, but we could see women delivering having attended only 1 or none visits. So with the introduction of Chamas, we could see the numbers increasing from even less than 10 mothers coming for or completing the 4th ANC visits. The same replicates to the deliveries. We used to record through the SHPs, we used to record many home deliveries. But with the introduction of Chamas, as they were brought, they came together in their sittings, they could see the sense of why they need to deliver in the facilities. We used to have like some months we used to record none, 0 deliveries. But right now, if you go to the registers, you can see numbers being higher than they were before. The same applies to immunization.
With the introduction of Chamas, communities have seen significant improvements in maternal health. Women are now more likely to seek skilled care during pregnancy and childbirth.
From our evaluations, we have been able to work on a number of, I'd say, concepts here and there, and we began as a feasibility study back in Bunyala in 2012, where we proved that participation in Chamas contributes 5-fold to increased maternal, newborn and child health outcomes. From the findings, it showed that women who participated in Chama were more likely to take up evidence-based strategies that include attendance of antenatal care visits, skilled birth delivery, uptake of long-term family planning methods, among other evidence-based strategies.
We have really learned a lot from this program. We sat down with the county government looking at what are the findings from Chama. We have been able to scale up and capacity build the CHPs and the CHARs on the Chama activities. And we are now looking at the aspect of sustainability, that even without having that aspect of Chama, is the county able to adopt? And that is the kind of policies that we now putting in place to see on scaling more other Chama, and that has really significantly improved the health outcomes within the county, and of course improved the NC attendance, improved skill delivery, improved the aspect of family planning uptake, and of course the quality of the women who are having that.
The Chamas for Change project has been instrumental in terms of how the county conducts its business and how we are doing our decisions right now. So I remember the first time we had the initial results coming out, and the county was really grappling with indicators to do with maternal health and child health, and we had not really looked at what the Chamas project was doing. So when we had that data streaming in, we noticed that there's a difference there. After that, I think we sat down with the Chamas team, given that they had a lot of experience. By that time, they had been in the county for more than 8 years. So we sat down with them, and together we crafted the Community Health Services Act. At that time it was a bill, but now it has been enacted. We're actually waiting for regulations, and even the regulations are informed a lot by what the Chamas for Change program has been doing. So the program has been very, very instrumental in terms of the decisions we make, and even in terms of the policies and plans we have put in place.
Central to the success of Chamas for Change is the Community Advisory Board, a body of local leaders ensuring the program truly reflects the needs of the people it serves.
If you look at the composition of the CAB, it is made of diverse members with the county government employees from different sectors, health, Chamber of Commerce and education. And at the same time, there are community members who played a very important role in the Community Advisory Board. So from the community, we have community health promoters, and we have representatives from the Chama Watoto groups, and at the same time the adolescent groups. The importance of this CAB is that we've been able to play very important roles. Number one, in being the voice of the community in the design and implementation of this project.
Being able to give back to the community is an interesting work, because you're able to engage and interact with them on a daily basis. We are trying to improve the health of women. We are trying to empower them with knowledge on decision making, being able to empower them also on financial capacity through the Group Integrated Savings and Health for Empowerment, so that apart from health, we also empower them economically.
Sasa nilipojiunga na hii chama yenyewe ikanifunza, nikajua family planning, nikajua mtoto anastahili chanjo zote, nikaingia nikajiunga hivyo, wakanishauri vile naweza enda clinic kwa hiyo mara 8, vile naweza kujifungulia hospitali na kutimiza chanjo zote kwa mtoto ili asiweze kuathirika na magonjwa.
Chama imeweza kunisaidia kwamba nilipojifungua mtoto wangu nikaweza kujua kumpeleka clinic, na ikanifundisha ya kwamba kujifungua mtoto sio mwisho wa maisha. Bado hiyo ndio mwanzo mpya wa maisha, utakuwa umefungua kurasa nyingine upya wa maisha. Ukijifungua mtoto si eti uweze rudi shuleni, unaweza rudi shuleni na ukaweza kutimiza ndoto zako. Sasa mimi kama Jane niliweza kurudi shuleni, nikaweza kutimiza ndoto yangu, nikafanya form 4. Na ikaweza kunifundisha jinsi ya kuweza kulea mtoto kwa njia inayostahili kama mama ambayo ningali mchanga.
Mimi mwenyewe nimeingia Chama nikiwa na ujauzito wangu baada ya kujifungua, tukawa tumeanzisha Chamas for Change. Tukasema sisi kama tumeingia hii chama, pia tutatafuta mbinu ya kujisimamia kama wamama. Tukafundishwa tukue pia na gishe, alafu tuwe na vitu ambayo tunaweza fanya kama wamama. At least ile inaweza kukusaidia kwa maisha wakati unaendelea kulea mtoto, na pia ulee mtoto kwa hali ambayo inastahili. So tulipokaa chini na wanachama, tukasema pia tunaweza fanya bidding. At least tukifanya hiyo bidding, tutakuwa tunapeana shanga, tunaleta pesa. Sasa hapo hivi unapata ya kwamba huwezi kosa pesa kama mama.
Hapo nyuma si tulikuwa tunaongojea clinic, ukishika mimba unakaa mpaka 7 months ama 8 bora upata tu nini kadi ya clinic. Hiyo tu ndio akili ilikuwa inashika, nipata tu nini hii mambo na maifas nini, hiyo dawa hatukuwa na mesa, wakitupea tunaenda kuweka nyumbani. Lakini tangu tu hii chama iliingia, walitufundisha jinsi ya kutumia IVAS, kutumia nini mambo na kwenda kliniki at least 8 mara 8. Na ikatusaidia na tukaanza kumeza hata dawa. Wakatuambia usipomeza hii dawa hata mtoto anaweza kuwa na affected, kukua mlemavu nini. Tukashukuru na tukatia bidii. Tukaendelea. Tukipata hata wamama wengine huko nyumbani tunawaelimisha, tunawaambia ukienda kliniki inafaa uanze immediately. Hata ukiwa na mwezi mmoja unaanza kwenda nini kliniki. So ndio daktari hawezi kupata nini kuona hiyo ujauzito wake inaendelea.
Inspired by the success of their wives, the men in the community formed their own group. Through this initiative, they support each other in saving, learning about family health, and taking an active role in the well-being of their families.
Mimi kuingia kwa baba toto ilipitia kwa rafiki yangu ambaye alikuwa na mke wake, alikuwa mwanachama wa mama toto Kirita Mnyaka. Sasa katika ile harakati mnakuwa mnapiga story nauliza au ifikaje masaa malema wako kabla kama mtembelea na kwambia wameenda Chama. Wakati na coincidence inatokea na siku nyingine unamuuliza na huko ni nini na kuanga na kueleza kwamba mwaliko kasanyana vijana kiasi. Mara ya kwanza tukaenda huko, ilikuwa siku ya kwanza tukapata kulikuwa na mafunzo mambo na upangaji uzazi, just family planning. Kafunzwa mambo mengi kuhusu family planning, na sisi na tukajiunga kama vijana, tukaongezeka tukajiita sasa baba toto.
Niko na shukrani sana kwa kuwa kwa hii chama. Hii chama imeenda kwa sasa tunaenda mwaka wa 3. Na tangu hii chama ianze imekuwa manufaa kwangu sana, hasa upande wa afya. Ikianza hii chama imenifunza jinsi naweza provide love kwa mke wangu na familia yangu. Na jambo la kwanza pale kwa love ni ile imenifunza mke wangu inafaa ninampea ile support. Na support hiyo anampea ni kama ile ya kumpeleka clinic, unampea ile love. Unaonesha kwamba kazi si ya maana sana kama afya ya familia yako.
During the study you find we are looking at the COVID. How did COVID affect the economy of families? So we realized that for them it's like it was an early mitigation. We didn't foresee that there will be COVID, but when COVID came in, there was something the family was doing. So if it is Mzee who was working, by coming home, there is already a poultry farming that is going on. There is a cow out of this loaning. There was a cow there, maybe they're milking at that particular time, they were able to sell the milk. So you'll find the man also got into it and was able to participate in those activities.
The true measure of Chamas for Change's success can be seen in the stories of the women whose lives have been transformed. Through health education, economic empowerment, and community collaboration, Chamas for Change is building a future where women are empowered, families are healthier, and communities are stronger.
We are planning to share in detail this journey in considering storytelling as a way of reporting our findings, but also getting feedback from the Community Advisory Board and also from the participants from the study.
What we would like to tell the world is we have resources in different areas that can complement. And when we say resources, funding is a major one. Academia and knowledge is a major one. But the solutions are within the community. The solutions are amongst our people who really understand how they live, the context that they are working in, and also that they can access support from us who have had the opportunity to be able to have advanced education and can now give back to our communities. Thank you.